doing all the right things. They're watching their weight, they're losing weight, they're exercising, and they still can't quite get back to their pre-pregnancy abdominal shape.
It's sometimes called mommy belly or mommy tummy. Let's be clear right up front. What we're talking about has nothing to do with weight. What we're talking about is a condition that affects as many as 3 out of 5 women. But despite that, it often goes undiagnosed. Heather Abraham has more on this condition, new at 5.
What sound does an elephant make?
Catherine Hill's son is 2.5, but she still gets the dreaded question.
I still have people come ask me if I'm pregnant.
Catherine is not expecting, and despite her athletic lifestyle, she wasn't seeing the results she wanted after pregnancy.
My stomach should just be back to normal. Why don't I have that flat tummy anymore?
She knew something was wrong when simple day-to-day tasks like loading the dishwasher or bathing her son were all of a sudden painful.
I'd have to stop and take a break. Just the slight lean over the tub or over the sink was causing me problems.
That's when she was diagnosed with a condition called diastasis recti abdominis, a vertical gap between her ab muscles.
Many people who are pregnant for the first time have a little bit of it. The second pregnancy seems to make the problem more evident.
During pregnancy, as your belly grows, your abs expand.
The six-pack muscles, which are in a normal state in the center of the abdomen, they wind up moving a little bit to the sides.
That takes away the structure and support from your abdominal wall, and when your belly goes back to normal, it causes a slight bulge that just won't go away no matter how hard you diet and exercise.
I said, oh, I just can't go for a walk and this will go away? She said, no, you need to see somebody.
For many people, that means seeing a physical therapist who specializes in DRA and can help you with specific techniques to repair the muscles.
There are 5 muscles, paired muscles, that work together. And if you can strengthen the other muscles, many times you can see an improvement in that separation.
But in extreme cases, surgery is needed. Dr. Kenneth Shestak is the head of plastic surgery at UPMC Magee Women's Hospital.
What we tend to see are people who really have worked hard to try to do it without surgery and still have a bulge in the mid portion of the abdomen.
And it's not just moms who suffer from this.
Actually, we see this probably more frequently in patients who've gained a lot of weight.
Men who do a lot of weightlifting can sometimes get it too. While it's not life-threatening, it's not something you want to let go.
If left to its own devices and it progresses, there can be problems with back pain, discomfort when getting out of a chair, rising from a sitting position to a standing position.
An ultrasound is the most accurate way to diagnose DRA, but you can do a self-test by checking 3 spots near your belly button.
Reach forward, lift your head and neck up off. Good, as I feel between the muscle bellies. And relax.
You can feel the edges of the muscles kind of pulling together. Yeah. And you can tell where they stop and where they start.
Following her diagnosis, Catherine started seeing a physical therapist.
Inhale and draw your breath in. As you exhale, engage the abdominals.
After more than 2 years of therapy and a regimen of at-home workouts, she's seen an improvement.
My diastasis was in a V shape, and at the top it was 3 finger widths wide. Now it's down to 1 finger width wide.
It doesn't really cause her much pain anymore, and she's no longer bothered by how it looks.
It is what it is. You know, I'm comfortable with my body, and I know that there's something there, and I need to continue to work on it.
Heather Abraham, KDKA TV News.
And Dr. Shestak says recovery time from surgery for something like this is fairly quick these days, thanks to advancements in how they do the operation. He says the procedure not only treats the underlying muscle problem, but also helps improve the shape and contour of the abdomen.